Hello, my name is William Fleck, and today we are going to be discussing the therapy process and how the therapy process works, how the therapy process starts from beginning to end, so from the first meeting to subsequent meetings, as well as getting into the nitty gritty of what is confidentiality, what is informed consent, how confidentiality works within a group setting, as well as determining if someone is a good fit for the program. So, the first step before the client even walks through the door is determining if they meet the requirements for the agency. In my previous course, I had to do a service learning where I got to watch that firsthand at Sarge's Place in my hometown. They have very strict, both VA mandated as well as agency mandated requirements to be within the program. So, when determining the need for therapy, we have to use the guidelines set out by the agency or sometimes even the governmental authority um, to determine if they will be a good fit for the kind of therapy modality that's practiced within that organization. This means not only looking at their past history, but also intake forms and other intersecting factors that surround a person and creates their ecosystem. So this can look like looking into background. Some places do background checks, or looking into um, gender, race, sexuality, um, those kinds of intersectional factors that can really help to understand where this client is coming from and if the practitioner is the best fit, or if maybe someone else in the agency is, or referring them out to a different agency and being like, you might fit better here. So, once we've determined that the client is going to be a good fit for their agency, their practice, whatever it may be, it is now time to begin the first meeting. This usually starts with scheduling the first meeting, but it's insanely crucial to the entire therapy process. Why? Because it sets the tone for the relationship. By setting that tone of these are our boundaries, these are what we want to work on, these are the things that are important for the client to work on, these are the things that maybe the guidelines might dictate of, like, showing progress or things like that. And also, it can be a time to discuss what the roles in the working relationship will look like. So, is the therapy going to be more interactive? Like exposure response therapy for people with OCD is going to be a lot more interactive of, all right, we're going to be working through X, Y, and Z. You might have some homework, as compared to more traditional talk therapy where it's more of like a discussion. So setting those roles, boundaries, clear guidelines for how the therapy is going to actually be rolled out to the client can be just as vital and just as important. And it also sets the tone of the fact that, like, when you're going in, how professional you are, how knowledgeable you are of the client, and showing that you're hearing them, you're listening to them, while also acknowledging that you've read into their personal history, you've read into the forms or the whatever may come before the first interaction. This can also look like ensuring, like, accessibility. Is the client able to get into the office easily? And just making those first impressions count. So then the working relationship starts with a positive amount of trust in that relationship. Now, perfectly segueing into it, session preparation. When preparing for a therapy session, it is important to review previous session notes if there's already been a session one. If there hasn't, then that would probably looking at the patient's intake form if it's their first session, as well as mentally centering oneself. So that you can be fully present and engage with what the client is saying with minimal distraction as possible. This is really important because we want to make sure that we are engaged, that we are actively listening, and that we aren't sitting there and looking dejected or disengaged due to our own personal brains going on. Preparation can also come in the form of researching and exposing yourself to new cultures and ways of thinking to better understand your client's worldview. Because if you have a client that's maybe coming to you that has a completely different worldview, maybe they're on a different end of the political spectrum, maybe they identify with a different gender assigned at their birth, which you may not relate to. Exposing yourself to those kinds of worldviews and cultures and backgrounds can really give you a lens in which to view your client's worldview and better understand the world, so then when they're talking about or expose yourself to new language, because then you can understand maybe they're saying a phrase that you don't quite get, but then you start exposing yourself to that culture and you're like, oh, I can understand that now. And especially with social media nowadays, it's so easy to find those different ways to find those kinds of resources to better understand where your client's coming from. Session preparation can also come in the physical space. How comfortable is the physical space? Is the physical space one that is warm and inviting? Is it accessible? Some people have, physical disabilities that make getting into buildings harder. Is it ADA accessible? Are they able to, if they're a wheelchair user, are they able to get in and out of your office as easily as possible? Is the furniture easily accessible for anyone? If you're working in groups or families, are there toys? Are there things to read? Are there things to fiddle with or to stim with? All these kinds of small little accessibility things that can just really build that trust within the relationship without having to do much, because it's showing that it shows warmth, it shows empathy, it shows care, because you're showing them like, hey, while you're waiting in the waiting room, I have something for you to read. I want you to feel comfortable here. When you and your family are here, let's discuss, let's talk, but the little one who I'm not discussing with right now, they can play with that toy in the corner or on the table or whatever, however the office is set up. Now that we've had the first meeting, we now also know how to prepare for future meetings as well as that first meeting. Now we can discuss the structure of the future meetings. Future meetings after the first meeting should build off of the previous sessions, all for the betterment of the client. Discussing what was previously discussed can be a phenomenal way to segue into the new session and provide structure to the meeting. If a certain topic felt it was left unfinished, or that needs more than one session to encompass completely, especially if you're dealing with people, maybe they have a history of drug abuse or PTSD or deep-seated trauma, it's going to take more than one session. And so by going back each session, reviewing, but then continuing forward with the treatment, it shows that not only are you paying attention and that you're attentive to their needs, but also that you're not just starting on a fresh slate every single time and not furthering the betterment of your client. Other ways is clients can also guide the session by being asked questions like, what would you like to discuss today in this session? Or last session we talked about this. What were your feelings or reactions to X, Y, or Z? Now, one huge topic within online forums, our own discussion posts within this class, and everything is confidentiality. Explain confidentiality is crucial because not only does it set the boundaries of what will or will not be reported to the authorities if the person is deemed a threat to themselves or others, and this can mean in the form of anything from suicidal ideation, plans, thoughts, things like that. So harm to self or others could mean actual physical, mental, whatever harm, but it also means child abuse, elder abuse, things like that. And it can ease the tension of that unknown, as many clients may feel wary or untrusting due to that level of mandated reporting depending on your state. By discussing with the client what is reportable and what is not, it can then help guide into a discussion of examples of what would qualify and can help build trust into that relationship naturally. A lot of the therapy process is about building that core trust, building that healthy working relationship. So then, say someone does bring something up and it does have to be reported, you can have that open discussion and be like, I see where you're coming from. I see that maybe in your culture that that's how you reprimand a child, or that's how you treat your elderly grandmother or whatever. But this is why I'm having to do X, Y, or Z. And while that can feel like a loss of trust, it's also keeping your client's best interest in mind and also keeping their environment in mind and keeping those people safe as well. Now, confidentiality within a group or lecture setting is going to look different. It may look different in really how it's handled. As practitioners, we can emulate confidentiality and communicate that we cannot share anything outside of the group, and we can set group roles or tenets around not sharing anything outside of the group beyond our own personal experience. Sometimes this can be referred to as what happens in Vegas stays in Vegas kind of rule, where what happens in the group stays within the group. You see this kind of within more formal group therapy settings like AA, NA, any of the anonymous groups, because confidentiality is so important. But we also have to make sure that we note that while we are agreeing as a group rule, it is also not something that can be heavily enforceable. Meaning like there's no legal repercussions if you're at a voluntary group and someone outside the group talks about it outside of the group. And that there may be, and the confidentiality may not be assured outside the group, but that there is an honor system that if she's not going to talk about your past or your time in the group, I'm not going to talk about like yours, things like that. So like that reciprocity of confidentiality. Another part of confidentiality that can be wrapped into it is informed consent. So this is usually a form that's wrapped into an administrative contract. Administrative contracts can be very helpful tools in therapy process by including confidentiality agreements, which is your access to records, mandated reporting policies, uh, anything that would fall under that confidentiality branch, as well as the payment agreements, understanding of cancellation policies, and any other administrative details all in one place to keep the admin side of the process as efficient as possible. Because you also don't want to bog someone down week after week by having, or when they're first starting, with a bunch of different papers, a bunch of different things to sign, contracts to sign, when instead you can just condense it all into one efficient form or one efficient packet, so then they understand who can access their records, what are we mandated to report. For myself would be in the state of Oregon, how payment will work, how cancellation policies, like is there a 24-hour notice, is there a 48-hour notice, what qualifies as what, will I be charged if I don't cancel within time, things like that. And it just helps create a more seamless process, and then you don't get tripped up if something happens, because you can pull up these administrative contracts and be like, well, this was signed, you understanding of this, and it keeps the legal side of things as clean cut as possible. Finally, we can then conclude a session. So concluding a session is just as pivotal as the beginning of a session. Not only does it act as a way to end the session on a neutral note, especially if the client is discussing topics that are heavy on them, but it also gives a good segue into scheduling for follow-up appointments or referrals for other services. This is also the time to discuss any new coping strategies or tools to implement before the next session that were discussed within the session. So when you are concluding the session, you can wrap everything up into a nice, neat bow, and then you're able to really just be like, cool, we discussed maybe using, and I'm pulling from personal experience, we've been learning some DBT skills. Are going to be, let's try using the tip skills before the next session, like we agreed upon in session. We talked about some deep familiar trauma. How are you feeling leaving this session? And let's follow up with another one next week. How does Tuesday sound for you? That seems to be the good day for you. And by wrapping up and being able to kind of keep that going, it also brings the client back to continue the process, so they can keep on making progress week after week after week, rather than just stopping at the one appointment. So then the therapy process can really be transformative and as helpful and as beneficial as it can be. This is my references, and thank you so much for listening. The therapy process is so vitally important for the social work profession, whether it be for case managers, admin, whoever. It is something that anyone in the field may run into in some way, shape, or form, both either personally or professionally. And thank you again.